My approach to a procedure we call augmentation mastopexy is for the majority of patients to do it in one stage, one single operation. With a breast lift or a mastopexy procedure, typically there's scars or incisions, and I'd say 99% of the time those incisions fade significantly and they go away over time. If you need a breast lift, I'm going to do whatever I can to minimize the scarring. The other thing I'm going to do is I'm going to try to limit the amount of scarring I give you in terms of the length of the incisions based on what you need for your individual breast. Every patient doesn't come in and get what we call an anchor scar or inverted T scar. Some of the patients do well with just an incision around the areola, circumareolar, or an incision around the areola and then a vertical line down, what we call circumvertical or vertical mastopexy. I can tell you whether or not you need a lift or not based on where your nipple and areola is positioned in relation to that crease below your breast. If it's at that crease or above it, most likely you can get away with just doing an implant if you're wanting to increase the volume. If it's below that crease or pointing downward, those cases are more severe in terms of the amount of sagging you have, so you're not going to get the optimal result just by putting an implant in. It'll give you a look of what we call waterfall deformity, where it looks like your breast is falling off of the implant. So an implant with the lift is your best treatment. Patient satisfaction is typically very high with this procedure because you're addressing two distinct problems. One is a lack of volume or fullness. The second is the loose or saggy skin. So by combining the two procedures in a single operation, it reduces cost, it reduces recovery period, and it gives them a rejuvenated breast in the sense it's fuller, more projection, more upper pole fullness, more cleavage, so a perkiness, so to speak, that they didn't have before.